Hello, my name's Eric Prosher and I represent Jesse Brown VA Medical Center. And actually I have two special guests from our center to talk about the sleep apnea and veteran health over the next 25 minutes. And so you're watching a live call-in interactive program brought to you by CAN TV. And so over the next 25 minutes, we're going to be talking with Kara Mayer, and she is a health psychology specialist in the psychology program at Jesse Brown VA Medical Center. And Sam Gable at the end of the table here, and he is specializing in neuropsychology, but they both work on helping veterans overcome sleep apnea. So please call in with your questions at 312-738-1060. Our lines are now open. So welcome to CAN TV Veterans Issues. Thank you for coming on, taking the time and sharing your expertise with us. So I guess where should we begin? You know, my name's Eric and I work at Jesse Brown in Transition Care Management Clinic, which, by the way, is located on 820 South Damon Avenue, and the phone number is there if you need appointments. But I work with post 9/11 veterans, and I have to say that the number one complaint of all our veterans is sleep. And one of the things, I also work in the PTSD clinic, and I've noticed there's an alarming rate of veterans that have sleep apnea. And they come to me, doc, and they complain. They're like, I don't understand, my memories, I can't remember anything, I'm irritable, I'm angry, they get sick, there's all kinds of issues, and they want to understand. So today we're going to talk about sleep apnea, and why don't we start with defining what it is?
Sure. Yeah, and I'm glad you mentioned you do work with post 9/11 veterans. So those are younger people, and that's not usually where we'd expect someone to start having symptoms of sleep apnea, but it does happen. And sleep apnea basically is a obstruction of your airway. So the soft palate, which is kind of back there in the throat, for a couple different reasons, it can relax and close the passageway while you're sleeping. And so sometimes people think this is just snoring, but what it is sort of this moment where you're not breathing, and it's usually in the context of snoring, and then suddenly the person is gasping for air, and they might wake up or they might sleep right through it and not know. And these are occurring multiple times throughout the night. So you're having multiple times where you're briefly for a few moments not breathing, and it kind of keeps you at a very shallow level of sleep, so you're not getting very good sleep. And that's where you're getting a lot of those signs like irritability and being fatigued during the day.
Yes, because sleep is one of those culprits that the lack thereof can mimic so many mental health and physical conditions.
Exactly.
So that's why I think it's so important for us to understand what sleep apnea is, because it impacts so many people, especially folks that are suffering from PTSD. But I do have a question. So if someone snores, does that mean they automatically have sleep apnea, or what's the percentage of people that might, and or how does one discover they have sleep apnea? What are common ways?
Sure.
Yes.
I think a lot
Kara?
of people do think that if they're snoring, it might be sleep apnea, but that's not necessarily the case. Statistically, I think it's around like 45% of people snore, but the amount that actually have sleep apnea is down about 25%.
Okay.
So if you're someone who snores and you're worried about it, I would say it's worth mentioning to your doctor, especially if you're having some of those other symptoms. So maybe the fatigue during the day, concentration difficulty, any memory issues, or if someone even maybe would observe that you're gasping for air or waking up or something like that. And if you do find that those are some of the symptoms you have, you can have what's called a sleep study. And during that time, they'll measure the breathing that you're doing at night, and then they can let you know if you're having any of these moments where you're not getting that oxygen.
Okay, I'm glad you brought that up, because I want to ask you about what are the next steps, especially for our veterans at Jesse Brown. You had recommended a video that could illustrate some of these things. So why don't we
Great.
take a look at that right now. This is, for those at home, this is a video about Shaquille O'Neal.
I snore?
Yeah.
See, I don't know if I snore because I don't hear myself, so.
Oh, he hears himself because sometimes it wakes him up. And he's like, baby, was I snoring? Yeah, you were snoring. It usually happens when he's on his back, and then he gets into that deep snore like it's deep. And then he stops. His chest would stop moving and everything, like he was not breathing. So I nudged him like, babe, wake up. And then he'd catch his breath. I'm like, dude, you just stopped breathing in your sleep. And I saved him.
Pam's a registered polysomnographic technician.
Probably what?
Polysomnographic means sleep study. She'll be the one putting the electrodes in.
Sleep apnea actually is a pretty common condition, which is most likely underdiagnosed and underevaluated because many people don't realize that they have it.
Well, every time I stop breathing, she, the next morning, yeah, sleep apnea. Yeah, sleep apnea. And I'm like, what is sleep apnea?
Well, sleep apnea is a condition where a person is unable to get air into their lungs when they fall asleep.
Every time the person stops breathing, they wake up. They stop breathing, they wake up.
And that exposes the body to a myriad of really adverse stresses.
And that does have consequences.
Irritability, can't focus and maintain attention.
They're unable to sleep in the same bedroom with their bed partner or spouse.
There's about a 7-fold increased risk of motor vehicle accidents.
It's linked with the obesity epidemic to being linked with cardiovascular or heart disease.
High rates of stroke, diabetes, and even mortality.
And so now we gotta fix it. Don't wanna go out like that.
I'm going to stop it there and we'll continue later on, but I wanted to, again, for those of you that might have just joined us, we're watching CAN TV and we're talking about sleep apnea, and we represent Jesse Brown VA. We have Sam Gable, Kara Mayer, and I'm Eric Prosher. And we have a caller. Great. Hi caller, how are you? What is your question?
Hi, my name's Brian. I'm in Chicago.
Okay.
I was wondering what your thoughts are on two subjects. One is, how do you feel about sleep studies? And how do you feel about naps during the day to combat obstructive sleep apnea?
Okay, thank you for your question. So there's two questions. What are our thoughts about sleep studies? And then, is NAP an effective way to combat sleep apnea? Thank you, Brian, for that question.
Thank you.
Who would like to take that?
I'll take, I can start because I wanted to let's talk about the naps first if, I think that's a good place to begin to clarify some. So napping is very typical with sleep apnea because people need to catch up for what they're missing. Unfortunately though, the same thing that's happening at night is going to be happening in the daytime. So
Sleep is sleep, right?
yeah, whether you're sitting in the chair, whether you're lying on your side, whether you're lying on your back, if you're having sleep apnea, it can happen in any of those positions. So still, the CPAP machine in particular, using the airway machines are going to be the most effective way to treat that. So napping, unfortunately, it's no escape for sleep apnea. About the question of sleep studies, I'm not really
Sure. A sleep study is really the best way that you can be assessed for sleep apnea. So like we had said, if you notice that you're having some of those symptoms we're talking about, it might be a good idea to talk to your doctor about that. A sleep study can be done in two ways. You can stay at the hospital and be observed while you're sleeping, but they also have home studies where you can have the equipment sent home with you so you can be in the comfort of your own bed if that's something that's more preferable to you. So they're both good options, and they'll give you that data that will really give us the information of whether or not you're having these aptic events.
Now, is that a definitive, you'll get a definitive yes or no, or is there a probability range after a sleep study?
Well, if it's all set up correctly, yeah, they will be registering those apneic events. So apnea just means a lack of air. So it's registering those moments when you're not breathing. And like the video talked about, they are important because a lot of times people have no idea that they're having apneic events. They'll sleep right through it because they don't necessarily wake up, although some people do. So a sleep study is a much more objective way to get a sense of if it's happening.
Right, and they'll tell you what severity of sleep apnea you have, so it's not necessarily yes or no. It exists on a spectrum, so you could be mild, moderate, severe, depending on how many of those events that you're having per hour. So you'll get that information as well.
So Brian, stay tuned. We're going to go a little further into this little video where Shaq actually goes to a sleep study and gets diagnosed, and then we talk about the treatment options as Sam had brought up the CPAP machine. But before we do that, why don't we just take one more caller? Hello, caller. You're watching Veterans Issues. We're talking about sleep apnea with Jesse Brown, with the team from Jesse Brown VA Medical Center.
Thank you for speaking on such a important topic. I have a comment and then I have two questions.
Great.
My comment is, I'm retiring today after 39 years, 2 months, and 8 days of service, and I'm a post 9/11 veteran, so it really isn't just young veterans that are having
That's
to
right.
deal with
Congratulations.
apnea.
Yes.
Thank you.
Question related to
The
that.
second thing is, I may have missed it while I was holding on the phone, so you've answered this. I apologize. Can someone speak to the correlation between service and sleep apnea? That's my first question. And my second question is, and it's been my experience that there's a lot of resistance on the part of many people, veterans in particular, to get sleep testing. And then once they have the testing, to actually be comfortable with the idea of sleeping with a machine. So can you talk about some strategies that you guys use that encourage veterans to get tested and encourage them to actually follow through and use their machines when they sleep?
Sure.
Great questions. I'm so glad you brought them up. So where should we start? So I just wanted to comment about, yes, our post 9/11 veterans are the whole age range, the whole gamut, and you had started talking about the kind of risk factors, suggesting that maybe age is a risk factor for sleep apnea. And he's asking about what's the correlation between
The veteran
service, active
population,
duty.
yeah,
Yes.
yeah. Sleep apnea and veterans, it is a very special population as far as sleep apnea is concerned, because there's different factors that can go into making that more of a likelihood for that population. But just speaking generally first, risk factors for sleep apnea include age, male gender, obesity, hypertension. Then you can get into sort of more nuanced things like the girth of one's neck, things like that. But typically as people get older, they'll have some sort of gradual muscle loss that can result in the loosening of the soft palate, and certain other things can push that over the limit as far as obesity, smoking history, hypertension, things like that. Some people, even though they're younger, it can happen to them too because of different genetic factors. But another reason why veterans are a special case is because there's a link between sleep apnea and PTSD. So we find it a lot in combat veterans or those who have experienced traumas in other settings where not only is sleep often affected, so you have this disrupted sleep, poor quality sleep, but it can actually increase the likelihood of developing sleep apnea, although the link is sort of unclear. Furthermore, those who have had histories in the military sometimes have been in settings where their sleep schedule was very unusual and variable, and they would have that circumstance for a long time. And so it can be very difficult to adjust to a civilian sleep schedule, sort of a normal routine that would have to do with the rising and setting of the sun. And so it's another way that sleep can be kind of chronically disrupted if it isn't addressed.
Wow.
That was answering that first question.
Yes.
Sure. And then I know he had asked about why don't some veterans maybe seek out treatment.
Yes.
And I think a big piece of that comes to the CPAP machine can be a bit intrusive because it is a facial mask or a mask that's on your nose. And so for somebody who, when you're asleep, it's a very vulnerable time. And so to have something on your face that feels somewhat restrictive can sometimes be a barrier. And so the reason that we're here talking about this today is that we do have different treatments and different options that we have to help veterans and civilians to really wear that CPAP mask, because we know it's a big adjustment to make.
Right. So what are some of the options at Jesse Brown VA to help people get over that that barrier of using the CPAP mask?
Sure.
Well, I think a big thing, even before talking about the patient level barriers, is the providers. Because if the providers can be very educated about everything that can be sort of warning signs, symptoms of sleep apnea, and everything that can go into it, because it needs to be recognized, and it needs to be explained clearly to the patient how conditions like as disparate as something like hypertension, having concentration issues, worrying about losing one's memory, obesity, diabetes, all of these can have a link to sleep apnea. If you feel like you're not losing weight, if you feel like you're irritable, you're worried about being able to remember words or things you used to be able to recall easily, that can have a link and you might not realize it. So being able to communicate that to the patient is very important. And then the patient can understand how all of these things that they might be struggling with could be improved with use of the machine, which ends up being a very effective intervention. But like you mentioned, there's a lot of resistance to it. And as Kara mentioned, having something on your face that's blowing air into it, it has an adjustment period. So usually if you can have adherence in that first 4 days to a couple weeks, that's a really good sign that someone can get through that first hump and stick to it. But sometimes people put it on, they don't like it, they're sort of fitful that first night, understandably. They take it off and they can't kind of get through that first few days that can really help cement a new habit like that.
I really like the points that you raised, that it's not just there's patient level barriers, but provider level barriers. And I was just talking to you recently about a vet that I worked with. We successfully treated PTSD and come back years later, and all of a sudden he was really concerned about the memory, the word finding difficulties, the irritability, things that weren't a problem, and he wasn't sure what that was all about. And I didn't know either, but luckily our neuropsychologist at Jesse Brown VA Medical Center, Dr. Walters, met with him, evaluated and looked, and found that he did have a sleep study, and that he was waking up 72 times in an hour. And this was impeding his ability to get restorative restful sleep, which is so important to be able to function.
And he didn't even realize he was waking up. Is that true?
That's right.
Yeah.
That's right.
Sometimes people will actually they'll wake up gasping for air and they have those symptoms, but maybe we could briefly talk about what the symptoms might be.
Yeah.
That'd be helpful.
But
or
before we do that, I was just going to show a little clip so the viewers at home can see what the CPAP machine looks like. So they're talking to Shaq.
That I can look at.
If a person is able to use the CPAP device, it works almost 100% of the time.
Let me.
Oh yeah, this is pretty good. This is nice. I like it.
All right, so we go back.
Effective treatment.
I have a mask here that I can look at.
If a person is able to use the CPAP device, it works almost 100% of the time.
Oh yeah, this is pretty good. This is nice. I like it. Can I wear it to the club?
Yeah, absolutely.
Oh, this is nice.
Okay,
I like
good.
it. I'll do it. Since I've met with Dr. C, and I've been getting at least 7, 8, 9 hours of sleep a day. Feel good. The weight is good. Got a lot of energy. The relationship is good at the house. Everything is working.
All right, so in there, I don't know. Shaq said it felt good, but some people have complaints, and we always tell them there are different types and versions of masks to use. So don't give up, persevere, and there's different fits and sizes and types
Right.
of CPAP?
At the VA, we have a variety of different sizes. We have a variety of different types of masks. So the one that you saw that Shaq has is more of a nasal mask. There's one that's an entire face mask that can be helpful for individuals who breathe out of their mouth a little bit more, and that might feel a little bit more comfortable. I think a big piece of it is really just understanding that this is a really effective treatment, and so you don't have to live with these symptoms. And so it's something that if you're recognizing it in yourself, it's something that you can talk to your doctor about and get that treatment that's very effective.
Definitely. And it can take a while to notice the benefits too. And I think that can be discouraging at first. The literature says it can take up to a couple months before you notice a change in some of the symptoms like the concentration issues, the fatigue, things like that, or some of the bodily issues like hypertension, etc. So it really takes some perseverance, but it is an incredibly effective treatment if you stick with it.
Wow.
Hoping for 4 or more nights a week. Ideally 100%, 7 nights a week would be best.
So, Sam, you were about to share with us some of the how a person might suspect or become aware of they have a problem with sleep apnea.
Yeah, so in my area, neuropsychology, it comes up a lot. We get a lot of people who come in. They're worried about memory. They notice that things like the recalling names of people they don't really know very well usually, or facts, they used to be able to recall them easily, or just they seem a bit more confused, disoriented sometimes. So they're worried they might be developing something like Alzheimer's if they're of age. So we ask definitely about CPAP, sleep apnea symptoms. So like I said, often people don't know. They'll sleep right through it. Even if it's 70 times an hour, they'll sleep right through those incidents. But we ask questions like, first of all, do you ever have an incident where you wake up gasping for air? That's helpful. We ask if people snore, because they are related. We ask if you ever wake up with dry throat or mouth in the morning, if that's typical. And we ask if you wake up sometimes with a headache in the morning that usually resolves on its own. The best way to assess this, obviously, if somebody has someone who is around them when they sleep, who can testify to whether they not only snore but have incidents where they seem to stop breathing. Because usually people stop breathing and the body goes into this process to kickstart open the passage back open again, so you're kind of get almost to fully awake and you're sort of jolt a little bit and then you're able to get back to sleep, but only long enough until that same thing happens again and then your body has to do it again.
Because Sam, I have a question. So I noticed this has happened to me a couple times, but usually like if I have a nasal congestion, a cold or something like that, would that mean that I have sleep apnea if I recognize it once? Is this something I should tell my doctor and get further tests for?
It's a really good question because certain things can aggravate or make it more likely to have these, obstructed passageways. So nasal congestion, also drinking alcohol, a lot of alcohol, whether it's heavy drinking or just very late.
Mine says I snore after I drink.
Yeah, so that's all going to be sort of disruptive. So I would definitely check it out if you're at all concerned. A lot of people would have nasal congestion, they're not gasping for air. So it could just be a sign that the passageway is usually open, but it only takes a little bit, so you might be kind of close, and it'd be worth a study for sure.
Okay. Wow. Well, I'd like to really I appreciate your guys' expertise, and for those of you that are watching from home, I'd like to thank you for calling in and with your questions and just tuning in. My name is Eric Prosher. This is Kara Mayer and Sam Gable. We represent Jesse Brown VA Medical Center, and we'd like to thank you for watching CAN TV 21. You can learn more about Jesse Brown. You can by checking out our Facebook page. That's Chicago Veterans VA. I don't know. I'll get that next. But stay tuned for the next 25 minutes. We're going to have Fathers Who Care that follow us. But VA Chicago, Facebook VA Chicago. And we'll be back again March 28th. And for veterans that, or for anyone that is having a challenging time, don't hesitate to contact our crisis line. You know, it's 1-800-273-8255 or TALK. Press 1 for veterans, but it's open to everyone. And there'll be someone there 24 hours a day, 7 days a week to talk live for you. And remember that February, this is the last day of February, which is it's American Heart Health, and we're going to celebrate that by doing something healthy for your heart. All right, so goodbye for now.